all, this is Devi Prasad. In this video, I'm going to explain about my dental experience and sharing for you. So this knowledge would be useful for find out finding quality of service and decision making before going for the root canal treatment and implants, crowns, metal bridges, and finding a doctor and cost of all these services. Okay, so first I'm going to explain my root canal treatment experience. Okay, actually my problem is I am having I'm having some. So I was having some bridge on my teeth. So the bridge stays on this teeth support. So this was root canal, but this was not a root canal. Okay, and because of not having root canal, slowly the tooth became infected. So I used to get a pain for every 3 months whenever the immunity is less in my body. So I used to take painkillers as well as antibiotics, antibiotics for every whenever I get a pain for nearly 3 days, and like that I try to solve the problem. But this is a recurring problem. So what it is, I tried to. I one day I wanted to take implants and wanted to remove the. So whenever I want to take implants, so they are going to remove my present bridge, dental crown bridge, metal crown bridge, and they would like to replace this crown bridge with new bridge. So finally, they suggested to go for the root canal treatment for this teeth. Otherwise, it's not possible. It's difficult for the next operation. So what I did, the root canal treatment is simple. They simply remove the nerve inside the teeth instead of removing the teeth. So they keep the teeth and they remove the nerve so that the it looks like other teeth, but without having any uh, uh, sense inside the sense for the teeth. Okay, so once I like that I had a root canal treatment. So what's my suggestion for the root canal treatments? For my suggestion is instead of removing the teeth, it's good for the root canal treatment by removing the nerve inside the teeth and filling the gaps with the filling material and put cement on the teeth to close the hole inside the teeth. So never try to avoid this problem. Otherwise, one day it damages other teeth. Maybe the infected teeth may affect other teeth also. One day there is no chance of going for the root canal treatment also. So my suggestion is immediately instead of postponing me for nearly 3 years and I am facing problem again and again, better go for the root canal treatment as soon. My suggestions for the root canal treatment, it nearly takes one or two sittings, uh, one or two sittings. In these sittings, what they do in first sittings, what they do is they simply remove simply drill drill the teeth and remove the nerve inside the teeth, and they'll put some um, uh, the temporary fill in that one. They ask you to stay for nearly 1 or 2 3 days. Later, after 1 or 2 3 days, they again drill it so that so it takes nearly 1 hour. So to open the mouth, it's difficult for more time to open the mouth, and both for the doctor as well as the patient. So that they ask you to come 1 or 2 3 sittings. So that in first sittings half of the part will complete, and second sitting they complete the next part. So at the time of that, they simply do injection for your gums to avoid pain for your teeth from the teeth. So instead of my suggestion is, instead of taking injection, that is I mean like a painkiller injections, uh, instead of doing painkiller injections for your gums, my ask a doctor to do the injections with less intensity inside the nerve of the teeth. So this will not affect for entire mouth anesthesia, uh, only simply specific part of the teeth. So I feel very comfort with that procedure. My doctor followed the same thing. So I had the same procedure for two teeth simply. Before I had injections for entire mouth, the injection effect would be nearly 2 hours. That causes somewhat irritation. So try to uh, go in this procedure if possible by taking the suggestion of the doctor. Now I'm going to explain about the implant versus bridge support. Okay. So in this case, I would like to explain something. So bridge is nothing but it simply sits on the support on the teeth whatever you have. So they simply drill around the teeth and they simply put another bridge, artificial crowns, you can say crowns, on the basing by taking the support of the existing teeth. Sometimes the teeth is not so. mm Instead of going for the bridge only bridges, my suggestion is go for the implants. So implants is nothing but it's artificial tooth drilled into the, it's like a pillar for our house, right? They do the same activity here. They do drill it here and put the pillar inside it. So but they will take this as a support instead of taking support of existing teeth. That causes so much of additional settings for the, they will damage the, I mean damage anything, but they remove the surface of the existing teeth. But my recommendation, do not go for the disturbance of the existing teeth. Go for the implants better wherever it is, wherever the teeth is missed. So it takes nearly 6 months process. Maybe this is a traditional process because I have gone for the traditional process, like first I had a pillar, I mean implant inside your jaw. Again, it will let it be for 3 or 4 months or 5 months. After that one, again they will put some more support on that implant to ready for the take the support for the crown, again crown. Okay. So my suggestion is, instead of simply go for the bridges, go for the implants, implant with bridges. Okay. So this avoids more stress on the existing teeth and damaging the existing teeth. Okay. So now you understood implant versus bridge support with other teeth, right? So my suggestion is go for the implant with bridge instead of going for the bridge support on the existing teeth. So next is on the crowns. Okay, crowns or bridges. So there are two types of crowns are there. One is metal crown with white surface. White surface. They look like a normal teeth only, but inside the base is made up of metal. And also there is another type of material like a zirconium. Zirconium. Okay, because I'm talking about the only basics. For more information, you can get from the doctor, because this is a highly standard one. Zirconium teeth. There is no metal called entire mm, teeth material is made up of one standard stable and very comfortable material. So I preferred zirconium instead of going for metal crowns. The reason behind is there is for metal crowns it weighs somewhere, it looks not that much of comfort in terms of weight of that crown, and the surface also, and um, and zirconium gives 15 years warranty. In my case, they gave 15 years warranty uh, for my all my teeth. Okay, that means warranty means if any breaks or damages, your doctor will recommend to the lab people to replace um, the crown. Okay. The next is finding a doctor, and so I, in my case, I visited a Bangalore doctor to take implants treatment. For he suggested nearly 2 lakhs. Okay, so for entire treatment. So instead of going for the that much of treatment, I got the same treatment in another city with almost 60% of the cost what he quoted. So my I what I did is I simply visited some doctors in Bangalore, and by paying some consultation fee, and I got full information about all the treatment processes, and material cost and everything, number of visits, the duration of the time period. By paying nearly 2 or 300 rupees. So get the quotation on the paper and compare the same quotation with the different doctors. So also one of my friend who was working in dental college, he suggested me to visit another doctor in Rajahmundry. So I visited that doctor, and he gave a quotation at around 60%. So this is a normal procedure, because in city doctors get ask you more money. This is an obvious. This is a normal process. Do not blame on them, because so if you want to reduce the price, better to go for the small city where doctors collect less money. Find out the best quality doctor in the small city. So I found one of the doctor. Mm, Satyasai Clinic, which is near to Rajahmundry bus stop. I mean, it is a Kotapalli bus stop. Kotapalli bus stop. Kotapalli bus stop near Godavari River. Kotapalli bus stop in Rajahmundry near Godavari River. Satya Sai Clinic. Satya Sai Clinic. He collected. So so the implant cost around 15K uh, with implant and its support also. Okay, and uh, I initially assumed 4 implants with six, not six, nearly 4 implants plus 14, 13 teeth, around okay, around 20, around 1.2 lakh, 1.2 lakh. So the same was asked, the same quotation was in Bangalore as almost 2 lakhs. Okay, but I got the treatment in Rajahmundry at 1.2. You can save up to less also if you go for any dental college, around maybe around 90,000, 90,000. So, but you need to find out. But the problem is the dental colleges is there is no proper integrity between different departments. If you know any doctor inside the dental college, or else if you know any dental college student who could manage all these activities like integrity, like one person can do like measurements, one person can do labs, one person can do um, root canals, one person can do some other additional surgery, maybe um, implant surgery. So one person can do all these things. So the problem with the dental college is there is no integrity. But if anybody knows from the dental college who could do integrity of all these services, you can easily get the service at less cost, or else find out a good doctor. So in this thing, what my suggestion for you is get a quotation on paper. What are the different services by putting simply consultation fee for your requirement, and go for the and number of sittings, number of then the time duration, then and like that, and also find the same quotation for near to your city and a small city around your city um, to get the service. And so in this video you learned many things like the procedure for mm, the root canal treatment procedures, implants with the bridge without implants by taking the support of other teeth, and crowns, which metal crowns are zirconium crown. Zirconium is very comfortable because I'm very comfortable with the zirconium crown. Before I had metal crown, now I'm very it's a comfortable in my mouth. I'm able to feel comfortable while speaking as well as choosing, as well as in all the aspects. And also I gave information about finding a doctor, also important, how to save your money if you have more implants. My suggestion is better go for I think two implants are four implants are sufficient for the lower jaw. mm, I mean, if you want to go for the if your requirement is more, just go for four implants, left side two implants and right side two implants. That is enough. No need to go for the multiple number of implants. These four implants could support for entire lower jaw. So, and sometimes if the age increases, they could yeah, they could do with two implants also. I mean, they they drill in cross manner so that they can these two these two implants could support the entire lower jaw in the old people. So just to have a discussion with your freely comfortable doctor. I mean, who could tell frankly speak with you, because I feel very comfortable with this guy. But but this doctor, his name is Satish. I will also provide his contact number, just contact information. I think it's not supposed to good to put here. It simply is near to Rajahmundry, Kotapalli bus stop in Rajahmundry, just near just a junction. There is a junction. You can see, if you ask anybody, you can see it. The hospital name is Satyasai Clinic. So like that, I got treatment now. Now it is good. This experience would be useful for many people, um and different aspects in the dental treatment.